World Vision International came up with what we call the Global Week of Action in line with our campaign called the Child Health Now campaign. And this campaign is aimed at reducing child death in the country. And what we're trying to do is get support from people around the world, in our communities, from our stakeholders, from our partners, from children, from mothers and fathers who have lost their children before they could make 5 years. So when we're carrying out the under 5 mortality quilt, one of the things that we did was visit different homes of mothers and fathers, and we're asking them to tell us what they felt about the child whom they lost. And it was not enough for them to just talk about the child who died. We were trying to encourage them to talk more about child death, to find a solution in their community, to try and prevent other children from dying. And we are not just getting out there to tell people why their children should not die. We are actually educating them and telling them to come on board and demand their leaders to take action now. So these are some of the community voices that we're able to capture. Mothers and fathers telling you why their child died.
The child got malaria. Within 3 hours, the child got anemia. The child died on the way going to school before we had reached even to the hospital.
It was the malaria which brought the death of my child.
Firwako omwana wange ng'olubuto lwa myezi 6 yafa saa 12 ng'okuba tetulina amasanyalaze. Totina atambule twongerayo mu ddwaliro.
Kati bwe lwaweze emyezi 7 nenzijjamuko omusujja mutonotono n'engenda mu ddwaliro. Kibina natuuka nakasongola abasawo bazaalisa okunkebera ne baŋŋamba nti omwana we yafiiriddemu munda. Naye mu kumuzaala navaamu amazzi mangi nnyo ne baŋŋamba nti nago amazzi ge gaviiriddemu olubuto okuvaamu n'omusaayi gwali mungi nnyo.
Mariodong gamo odwe bi tiara bisie apian kara daga gamo menota daga ma der daga odwe di abin ma tia bisie daga kara ma ngwana ma der wa tiara yar se timu no ne annual tiu ya pe sama gamo iya gituyo tuati bora.
My child died of measles because we were staying very far, whereby we cannot get a nearby health center to my child to be immunized.
Ana bina very pera atuo tena ana better to me HIV kirme go katin telo yako temi yatin tetako eti ana tie
tuono longa kakanya cho ta top lo corner gan yo ka kono
gan yo ti oti mangwan pe
twale oria
men.
In our village, we were hard to reach area. We don't have roads. The government should help us to give us roads. Even the health workers, the health centers is very far in our village. So we still have another problem of RVs. The government should help us to give us health centers.
So those are some of the cases of mothers and fathers who lost their children, and it's very evident that the biggest cause is infrastructure. Most of them could not access health services. And for example, some of the health centers that we visited were very far off, that mothers in labor could not access them very easily. It's not every day that mothers and fathers who have lost their children are given an opportunity to talk about their loss. As you can see, they had so much to say about their feelings, about their grievings, about their loss. And probably if World Vision had not gone in to provide this platform, they would never have spoken out. They would never have an opportunity to be heard. That is why this quilt was very important to us, but most especially to them. And we're going to use this evidence to show leaders, to amplify these community voices so that they can speak for themselves and demand and ask for something to be done.
Our request is that to the people of World Vision, if they could add for us more health center, 2, 3, to the nearby place, whereby we can immunize all our children.
World Vision umiti ipor pewa imiwa gina me wan ramu to yutena teno kado nywale HIV Yen gor watie wan jo chol.
Wane do na an ke pekana do anda dong en do miyo kon ani ya yo kit taka ma be ka bala me wot ke timo ngo be pa puri ma kan ya tia ka wot ke ya gir my can pay.
Now government should give enough medicine or enough drug to the health centers tools in the village so that to eradicate this malaria.
Gina pe pega ya lego me ya remi ram da pian ya el center ka en be ya perena ki chiara wi ni chi wil ya wila ni che ya diet pa ya diet be ki chiara mi kon be kat be ki chien ka wa ki kun ka chien pe gi neni ma
I'm calling upon the government to supply us with the adequate insecticide-treated mosquito nets.
The government should provide for us enough improvements to the units, to the nearby units.
Government njagala etuyambe etuwa obuyambi amasanyalaze tetuyina ku ddwaliro ebibika abaana ng'olubuto olubuddemu nabyo tetuyina oba batufundeko n'entambula esobola otwongerayo awala bwe babanga waliwo ebyetaagisibwa nga wano tebiriiwo.
I'm requesting government to supply for us adequate drugs, anti-malarial drugs, such that children are supplied adequately.
Batwongereko obuyambi ku ddwaliro lyaffe obuyambi butono kuba otuuka n'ofuna obuzibu ku ddwaliro awo naye nga tolina na ntambula okutuusa nakasongola ate nga nayo kenyini sente tolina ezikwongerayo.
So that is what the mothers and the fathers had to say about the loss of their children. But it would be a shame if after they've experienced their loss, their grief, all this is put in the shelf. We are calling upon leaders to use this evidence to take action now, to come up with initiatives, to look at the laws and systems that will work towards making sure that children do not die, especially children dying to preventable diseases like malaria. That should not happen. So at the end of the 2 weeks that we had with mothers and fathers in the community, it was time to meet policymakers. And we met policymakers as a coalition. We had support from Ministry of Health. We had support from other child-focused organizations. We had support from the media and even from the community members, some of whom we had interacted with. We wanted to show our policymakers that child death was important and therefore should be priority. And the quilt was displayed to show all the policymakers that this is just a sample of the children who died in a few visited districts and villages in Uganda, but something has to be made from their side. They have to amplify these voices. They had so much to say, but first we're looking at what are the ways in which we can support policymakers to prioritize issues of maternal and child death so that they can promote them, so that they can debate on them in parliament. So at the dialogue, we had policymakers, our stakeholders, community members coming up and sitting like in a round table discussion, just talking about how they can make sure that children do not die anymore.
It is therefore for this reason that the government should place the rights and health of children and their mothers at the center of its development agenda. Health services in some communities are inaccessible due to chronic drug shortage, inadequate qualified staff, lack of emergency obstetric care facilities, and we therefore call upon the members of Parliament to ensure that there is an increase in the health sector budget allocation to 15% of the national budget by 2015.
The Parliamentary Committee of Health has dedicated itself to participate with all of you, with everyone who is interested, to make sure that we come up with what is the missing link and what must be done. The second area is improved coordination and supervision to ensure that investment in drugs and other medicinal supplies, infrastructure and human resource optimally and effectively translate into positive measurable health impacts and outcomes. We have, for instance, right now we put in up to about billion, about 230, 250 billion in drugs. As Parliament, if we handle these three things, human resource crisis resolve, improve coordination and supervision, and restructure the health system, in our view, we think something will be done. Now, because of this, we have decided to undertake a serious exercise that will include many other things, but one of the things we shall do is we are going to have public hearings throughout the whole country.
So during the Global Week of Action, we had a symbol just like any other successful campaign. And the symbol was raising up our hands with the slogan, "Count me in, I want children to survive 5.
Count me in, I want children to survive 5.
The climax of the Global Week of Action in Uganda was the Child Health Now concert. And it was a less informal way of interacting with the public, as they listen to music, as they interact with one another. It was not just music for enjoyment, it was music with a message. They were talking about child health, they were talking about how can we work together from our families and our communities to make sure that children do not die in a very relaxed, informal way. And we partnered with Kwela Band, a very popular band, and they composed a song entitled "Count Me In, I Don't Want Children to Die Before They Make 5 years."
As you are all aware, Awake, the Every Woman, Every Child, was launched by the UN Secretary General Ban Ki-moon in September 2010, and it aims to save 16 million women and children, prevent 33 million unwanted pregnancies, end stunting in 88 million children, protect 120 million children from pneumonia by 2015. As a Ministry of Health, we have evidence-based strategies of programs which are being scaled up through a multi-sectoral approach. And these include the Child Survival Strategy, the Maternal Newborn Mortality Reduction Roadmap, the Nutrition Action Plan, Environmental Health and Strategy and Sanitation Strategy, the elimination of HIV transmission to children. And these are actually key areas that need to be addressed in order for us to achieve the MDG 4 and 5. Also, as a ministry, we intend to introduce vaccines, especially for pneumonia and diarrhea, next year, and hopefully this will also help reduce on the child mortality. We have currently secured the World Bank loan, US dollars 45 million shillings, and we are going to use these funds to improve infrastructure, have the ambulance system in place, recruit additional staff, and of course, procure family planning commodities. I want on behalf of the government to thank World Vision for the complementary efforts towards the health sector. We in the ministry pledge to work with you and in a very transparent way provide oversight and accountability to the public, monitor results and resources to ensure that they translate into changes in the survival of our children, and of course in the attainment of the MDG 4 and 5 by 2015.
The time to act is now. We are calling upon each and every individual in Uganda to support children to grow beyond the age of 5. I believe you and I can do something in our own capacity to make sure that children live beyond the age of 5, so that in future we shall have a more productive generation if these children live to become prosperous in future. So join Child Health now, join us, and let us all raise our hands for a good cause.